Yes, welcome, my friends. Welcome, my friends. I didn't finish the talk. Some issues came up. So today we want to learn about how people can know that they have a heart condition. And we have been talking about heart condition. We have been talking about heart issues. We have really talked about several things about the heart, and it is important time that when you cannot just take someone to a hospital and then you say that this person has a heart condition. Susan Mwendwa, welcome to the platform. Thanks for being here, and everyone that is logging in. You should take a person to the hospital, and then you try to know what the doctors are doing, because sometimes when the doctors are doing some things, you are there like, what is happening? What is happening? What is this that you are doing to my patient, to my relative? Eh? You are just telling me medical words and I'm not loading them. Please explain to me, my fellow doctors. And those doctors are not there to explain to you. They are busy walking around. So when they give you the results, you are there surprised. What are these things? So that is when you come and you find um, Benjamin the Wise Guy. You find Benjamin the Wise Guy's channel, and then you start checking on and checking on, and doing what? And revising the notes so that you can understand. Sometimes doctors, we are very, even telling you and explaining to you word by word becomes a problem. Hmm? So today we will know how there is several ways of knowing that this person has a heart condition. One is by how we looked on what we were doing on. You look on what? The physical appearance. The physical appearance. Then when he's going to a hospital, what do you do? There are some things that the doctors do. So today we are going to look at what the doctors do. What the doctors do in the hospital, like laboratory tests and like what? ECG. Today I'm going to explain part of this. I'm going to explain part of this so that we can know what are these. Some people just see papers. Minute. Just a minute. Just a minute. A minute. I said something here. This something is disturbing me. Now, you see, it is important when you go to the hospital, you just don't stand there and at times you don't know what to do. It is better you have something called technical know-how. Even if you are not a doctor, you know what you can do when you're reading those results that the doctors have given you. Even the students that are watching, this is a learning process. It is important for you to know the basics and the deep ones so that you can prepare a patient well for everything. Basics are the fundamental of everything. Because life, when you start learning about biology, what do you learn? The first thing you learn is you learn the cell. The cell. Then you grow up digging, and advancing up to tissues and organs. And then you become a human being, for those who are doing medical field. Thanks a lot for those who for the topics before that we have done. We have really talked about the heart. We have really talked about this heart. This heart, we have really talked about it. And now it's time to start to know the problem, and then after the problem, because I was not dealing with, I was not dealing with I was not dealing with treatment, as you notice. I was dealing with the problem, how this problem is coming, where does it come from, how does it start. That is called the pathophysiology. Pathophysiology. Pathophysiology in medicine is patho is called disease, and physiology is how it comes. So pathophysiology, and then we go to pathology, the problem itself, how it comes, and the problem itself. Now, fellow people who are watching and who will be watching where you are and everywhere, let's check on this. This is very important and it is very nice. Hey, there are some things when you go to a hospital and blood is taken that are in a person's blood. Why? We have examined you and we have seen that you may be having a problem with your heart. Maybe you have been having dyspnea. Dyspnea, you saw it is lack of oxygen, of breath, or maybe bluish colorations that we talked about. That is called cyanosis. You get it? Those are the things that we looked upon, and then we say this person is having a heart condition. Then we auscultate you, we take the stress, we auscultate you, we find there are some abnormal heart sound. We say no, this heart should be having a problem. So what is the next step? You think of laboratory. How can we take this person to a laboratory now? The laboratory is the determinant factor when it comes to the chemical composition and the things that are going in your blood that are produced after the heart is bringing problems. And then after that, we will go to something called radiology. Radiology is these things now when you come to EKG, you see, EKG, those are now where we go and we check and see, now this is a problem, it needs to be sorted like this. Now, what are the laboratory measures that we check when we are doing what? When we are analyzing a patient of, when you are analyzing a patient of issues concerning the heart, what are the things? They are the most important laboratory tests that I'm going to learn. There is something called troponin. What is troponin? Let us check and see what is troponin, because when you just you are in hospital and they have taken your blood to the laboratory, the blood is not just going there to check the normal things, it is checked. Kitchen, Stan's kitchen is in the house. Thank you so much for logging in. I've just started, and I'm saying we examined that. We started by checking the problems. We examined the patient. We checked. We took the stethoscope, inserted it to the person, and then we examined the chest cavity. And then we found out that this person has several heart sounds that are abnormal. You get it? So if this person has several heart sounds that are abnormal, how can we help this person? How can we help this person? Now this person is in the hospital. We take blood from this person to take to the laboratory. Blood in a hospital, it is done so many blood work, so many tests. So there are specific tests that we do that are telling us this is a heart condition and it is coming, it may be coming from. So the doctor analyzes and says, let's do this and this. No, I forgot to tell Uncle that I'm online. Let me check if he's okay. He told me to tell him if I'm online, I tell him. Okay. Let me ask him if he is okay to come on so that we can learn together. Yes, he's a very generous guy. He's a very good, nice guy. Sometimes when I talk of Uncle, I feel good. Uncle, yes, I don't know if you are in position to come online. Yes, at that time I was because you cannot just take blood to the laboratory and then you tell the laboratory technicians, now, you laboratory technicians, this patient has a heart condition, please do lab works. No, you as the doctor yourself, as the doctor, and you who has taken that patient to the hospital, you need to know this patient of mine has to be done this type of test. This patient of mine has to be done this kind of test. And why? Because A, B, C, D. We don't want to be using finances to service things that are obnoxious. That one. Where has that one come from? Or may I say ambiguity? Because now you have gone to a private hospital and people want money, they start writing a lot of tests so that they can know targeted tests to the blood works. The blood is in the laboratory. This person has a heart condition. What the doctor has written down, because now you are the doctor, you are the one to dictate what you need to. The doctors have the right to dictate what you need to be done as a blood work. You see, Jamaican uncle in the house, always supporting me. Jamaican uncle. One day, one day, I'm gonna do good things. The singing doctor. One day, when uncle will be in Kenya, I will do a video with him and we will eat nyama. The dedication will be upon you. And uncle, invite the YouTubers that are your fans so that we can eat that meat together with you. You are so supportive. Yeah. You are so supportive. Thanks a lot. Thanks a lot. Even Judy is here and she's so supportive. So we are saying, when you are taking that blood to the laboratory, you see the protocols of assessing a patient. I even started with telling you how these problems are, how they come about, how we can handle them, and then we toned down to what? We toned down to say now we are in examination. Yeah, when we were talking about blue colorations, when we were talking about paleness. Judy, welcome so much to the platform. Nice and lovely. I've said light and lovely. Nice and lovely was a lotion. Nice, Judy. Thank you for coming in. Thank you, baby. Thank you, baby girl. Baby girl who is always silent. And if you go to the life of Jay Kingre, she's always calm. Hey, Jay Kingre, that is a nice posture. Say hi to family and tell them Benjamin, the wise guy, has said hi. Now, when we have examined the patient, the doctor has examined and is hearing heart sounds that are not good in the heart, and the pain that is coming central and it's not supposed to be there. That is where you are admitted. We take blood from your system and then we take to the laboratory. In the laboratory, this blood is not going there to do some painting job or what. In the laboratory, the doctor has instructed the kind of test he needs. And that's where now I'm taking you one by one. Just imagine I'm taking you one by one to the laboratory of Benjamin the Wise Guy Ben Hub Medical Center to explain to you what we do in the laboratory with your blood when a person is screened. When a person is screened with heart conditions, because there are some tests that we do. So in that blood, there is something we call troponin, troponin markers. Yeah? And what are these troponins? Because we want to check if you have them. Troponins, specifically cardiac troponin and cardiac troponin T, I and T, are the most sensitive specific markers used to diagnose myocardial injury, particularly myocardial infarction, heart attack. What are the troponins? Are regulatory proteins found in cardiac and skeletal muscles that control muscle contraction. They are released into the bloodstream when heart cells are damaged. So when your heart cell is, you see, these are cardiac markers in the muscles. So they control skeletal muscles contraction and relaxation. So when you are walking in your muscle, when you are walking, your muscles help the muscle to contract and relax. Remember, the heart, itself is a muscle, so it has troponin. But when your heart muscles are dying off because of oxygen, what do we get, my fellow people? They are released in the bloodstream. So when your blood is taken to the laboratory, they do something called troponin I and troponin T. They do something called troponin I and troponin T. Gold standard for diagnosing myocardial infarction. MI, heart attack. That one we call it heart attack. And you see, we have said MI means there was loss of oxygen and part of your muscle is off. And any muscle that is drying off, what does it do? It produces troponins into the bloodstream. See that? So when your blood is taken to the laboratory, what do we check? We check on these things. We check if you have troponin in your blood. Is it there? If it is there, it means there is part of your muscle here that is dying. So the laboratory technician writes down troponin I and T positive in this blood sample before he returns to the doctor. And if he returns, the doctor will now say, yes, Barry, walking exercise for you here. Hey, blessing host and everyone. Thanks. Can everyone smile for Barry walking exercise? Some hugs and claps. Welcome, Barry. Welcome, Barry. Welcome, Barry. The topic today is how to know you have a heart problem and how to diagnose for the specific problem that we have said. The specific. We don't want to gamble with someone's life. We want to know this is the specific thing that is eating this person. So if this is the specific thing, how can we deal with it? Next, we'll go to treatment. Now, troponin I and T have been found in your blood in the laboratory. Note down, takes to the doctor. The doctor says, this must be myocardial infarction. Why? Because troponin I and T is released when the myocardiums are dying, muscles of your body are dying. You see, man, you see how medicine is a science of proof and tests. And what? Treatment. You cannot gamble with a person. You get it, man? You get it? You cannot. You have to do scientific laboratory tests. Now we are at the troponin. It is the gold standard of myocardial infarction, highly specific to cardiac muscle. So rise 3 to 6 hours after myocardial injury. Now you have chest pain. After 3 to 6 hours, you go to hospital, it starts rising. We get troponins in your bloodstream. And then at 12 to 24 hours, it is peak. So when the blood has gone, these troponins can tell us when you started having the chest complaint. So when you have chest complaints every time, central chest complaint, my guys, what you can do, my good fellow citizens, you can do a test called troponin I and T. And if you are in Kenya, just walk in Benham Medical Center, come, we analyze you, we check you, we smile, we talk, and then we advise you. So we continue. We have said, one, it is used for acute myocardial infarction, dying of the muscles. Myocarditis, when you hear of myo means muscles. Carditis means infection. So troponin in myocarditis, it is there. Heart failure, pulmonary embolism. If you are not, you have come in today, please start this topic from the beginning. It will give you an advancement. It is a life-changing because our hearts are our everything. You see, when you are heartbroken, what do you tell someone? Why are you heartbreaking me? And you are suffering emotionally. You want to play with my heart. My heart. So our hearts are everything. They give us life by taking oxygen around every tissue of our body. You see that? Don't play with the heart. Like, don't hurt someone emotionally. Eh, don't make your man suffer, because don't make your girlfriend suffer. So let's not make our hearts physically suffer. Let's take care of them as they needed. Yes. Sweet, eh? You see how it is sweet? Let's eradicate heart problems. Let them go. Just as Barry exercise is telling us, let's walk. I heard Joseph Hill singing a song, walk, 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 walk. Let's go to Zambia, walk. Let's go to Jamaica, walk. Exercise is important. So we have talked about troponin. Our blood is still in the laboratory. And I've said we have many tests that we are doing. Come on, there is another test. What is that test? What can the blood do in the laboratory? Now you know. Creatinine kinase, MBCHMB. You see, in the laboratory, now the laboratory technician takes the blood, says the doctor has written here, he wants to know about the creatinine kinase levels. The creatinine kinase levels. It is produced 6 hours after myocardial injury. You see, we are still at the heart muscles. When you hear me saying anything myo, just know I'm talking about the heart muscles. You get it? So 12 to 24 hours, return normal in 48 to 24 to 72 hours when you are injured. So detects reinfarction due to short duration of elevation. This one, when you have acute thing or you are suffering from pressure, you have been having something called fibrillation. You remember fibrillation? Some fibrillations are some, what can we say? Fibrillations are tachycardias. Tachycardias are heart that is beating or is beating at a high rate. Fibrillation is excessive high rate. You get it? High rate and excessive high rate. So you've taken that blood to the laboratory. And when you've taken that blood to the laboratory, what else is it done in the laboratory? Creatinine kinase. The laboratory technician takes that blood and detects infarction due to the duration and elevation. You see? If he finds creatinine kinase, because we are being told in your blood, it will be there within 48 to 72 hours. He knows, oh, this person might have a problem that is lasting for 2 days, because 12 to 24 hours is the peak period in the blood after you have hurt your chest. And then 48 to 72 hours can return to normal. So you might have hurt yourself within 2 days or 1 day. You see, then he writes creatinine at this level, at this junction. The doctor will know, oh, this problem started this. And that's why sometimes you cannot lie to a doctor. That condition just has started. A doctor will look at you and look at the results and know this patient is lying to me because of A, B, C, D. So this doctor will tell the others that have brought you now, leave me with my patient. Let me talk to this patient we know. So he'll take this patient now. You have told me this case started this time. But the results are showing me something else, my friend. They are showing me something else. And the patient will tell the doctor, you know, I didn't want to say because this one and this one that were here, they could be mad. You see how doctors we know when you are lying to us, when you have social issues. So if you are coming in right now, chapa the like, it hit, chapa is hit, chapa the like button. I know today some people are learning some words. Chapa the like, and let's see how the going is going to be. Jamaican uncle in the house, King Ray house. Tomorrow, King Ray will be having a live. Please, let's join our sister Judy. We check out the live. We have seen our sister Susan Mwenda official and Stan's Kitchen dropping in and saying, Benjamin the wise guy, we are here. Now, we have seen creatinine kinase. Now, there is something else. You know, I've said the blood itself, we can take several, but these ones are particularly hitting the heart itself, the heart. You get it? Now, there is something called myoglobin. So I've said, any place you hear myo, just know I'm talking about the muscles themselves. So there is something called, hello everyone, Beatrice Bime, my baby is here, my baby girl. How are you, baby girl? How are the kids, baby girl? Are they doing good? Nice. Very nice. I'm happy to see her here. Now, we continue and say there is something called myoglobin. It rises between 1 to 2 hours after injury. 1 to 2 hours after injury. You see, earliest marker but not specific to the heart. So this one, the doctor does it just for the way. Early detection when combined with troponin. So it may be combined with troponin and then you find out there is a problem. You see? And then there is something called lactate dehydrogenase. Hey, someone will tell me that is a heavy word, my friend. That is a heavy word. No, it's not a heavy word. Historically, used in MI diagnosis, but now largely replaced by troponin. Lactate dehydrogenase. Lactate is lactic acid. Dehydrogenase is an enzyme. Anytime you hear about dehydrogenase, let's learn about this something about dehydrogenase, kinase, all those kinases, dehydrogenase. These ones are enzymes. And if you have a question, my friends, don't fail to ask any question. Don't fail to ask a question, because asking is learning. Yeah. So lactate dehydrogenase is intracellular enzyme used in clinical medicine as a non-specified marker of tissue damage. You see, when you hurt yourself somewhere, lactate dehydrogenase is released. Although it is largely been replaced by most biomarkers, lactate is an enzyme that catalyzes. Oh, Sha Travels is here. Sha Travels. Hey, I see you and I feel good. Oh, are you driving? Are you driving, Sha Travels? I know every time I see your lives, you are on the wheel. Hey, Sha Travels. Come to Kenya and I will sort you an SUV or a saloon car. We see if you can drive in Kenya. Jamaican uncle was here and he told me him with Ridley, I can't drive in Kenya. Chaos, chaos in the road. Hey, I am coming to Kenya so I can hang out with family and you'll see how crazy I am. Jamaican uncle told me, Ridley, I was driving and Ridley was, hey, be careful, be careful. Now, my people, let's go. We are learning about how to diagnose, how to know heart problems. So we have come to an enzyme called lactate dehydrogenase. Lactate dehydrogenase is an enzyme. And this enzyme called lactate dehydrogenase, you see when you cut yourself, you feel somewhere, guys, talk to Ben, get so excited when they come to Kenya. I always put a smile on his face. Uncle, I can see you are here. Tell Sha Travels how you are telling me to drive carefully and I'm very comfortable. And and really was about to fly when I was at the roundabout. Please tell Shatravel. Yes. Now we are at lactate dehydrogenase. You see, when you cut yourself somewhere, or you hit yourself somewhere, there is an enzyme that comes out of your cell that it's called lactate. That enzyme, its work is to catalyze the reverse conversion of pyruvate to lactate during anaerobic metabolism. Hey, oh, those are the role of it. And it leads a role when you are injured. LDH leads into bloodstream. So when you are injured, it reverses some process so that you can heal. And in the heart, before we found something called troponin I and troponin T, it was you. Hey, Judy Simba is here. Just imagine Judy from South Africa. Hey, all my darlings are in the house. I love to see Judy and everyone when they are welcomed here. Judy, how is South Africa? Are we still singing Titiango my oh malenya I go una titi oi oi. Yeah. Good one. Welcome, Judy. We are talking about how to know you have a heart problem when you are when you have taken your blood to the laboratory. Now, I've said this is just part of the beginning, because you know in your heart you have to be specific to what you are treating at work in the background. Okay, so it's okay, Shatravel, it's okay, Shatravel. You can Brenda Fassie. I really loved Brenda Fassie. May the Lord rest her soul in peace. Oh, Brenda Fassie even sang in Kiswahili. Nakupenda nakuranza weni yangu. We love South African, men. I love South African music. They are good music tunes and everything. Remember our top reggae artist who was called Lucky Philip Dube. I try to sing to his pitch and I cannot. That guy was blessed. That guy was blessed, man. Hey, that guy was blessed. That guy was blessed. Sometimes I try his pitch and I go off tune. But we are left with the daughters and they are doing a good job. We thank God. God has a purpose for everything. Now, here, we are diagnosing people now. I'm explaining to people how, when your blood is taken to the laboratory, what we are looking for when you have a problem with your heart. Now we have come from troponin, which is released when your muscles are dying or your muscles have a problem of lack of oxygen. We are going to creatinine kinase, where creatinine detects reinfarction due to, and it can give you time when the levels can tell you when this problem started. And then we have gone to myoglobin. What is myoglobin? When you hear about myo, you know we are talking about muscles. Globin, myoglobin, hemoglobin. It means there are connections of muscles and, you see, proteins. Muscles and proteins, myoglobin, hemoglobin. Heme is the iron. Then we come to globin, the muscle, the protein. You see, you see how we connect things 1 by 1, 2 by 2, 4 by 2. Now let's continue. And we were at this funny thing called lactate dehydrogenase, and I was explaining, when you hurt yourself any muscle, you release something called lactate dehydrogenase. It helps to reverse some things at the site of injury so that you can heal. So that you can heal my people. So when it is done and then we see troponin is positive, troponin I and T is positive, and then we see lactate dehydrogenase, we usually know your heart is injured somewhere. Then we go to something else. You see, all these are now, you are at Denham Medical Center, and I'm the doctor, and I've told the laboratory technician, I want you to do troponin I and M, I want you to do creatinine, I want you to do myoglobin, I want you to check on lactate dehydrogenase so that I can know if this person is okay. Check me out, my family. Then we go to new natriuretics peptide. This assess heart failure and ventricular strain. Natriuretics. Today I'm not writing. Let me write this. Let me post this. Natriuretic peptides. You post this so that someone can ask me, and what is the spelling? I want to learn more about it now. That is the spelling. This assess heart failure and ventricular strain. When your ventricle strain, you see, like when you were talking about, sorry, let me pass like that. And then you see, when you are talking about tetralogy of Fallot, we say there is a hole here, and this is put to this side, and this side is becoming bigger. And the old age again, when they are suffering from heart condition, this side becomes bigger. It releases, when it is stretching, it releases something called natriuretics. Natriuretics are released from ventricles in response to pressure overload. So when there is a lot of blood in the ventricle, especially the right ventricle, it is stretched. You remember isolated hypertension at the ages of 55 going above. This one is the problem, stretching. So when it's stretching, we release some things called natriuretics. Natriuretics. Say again, natriuretics. B-type natriuretics and N-type natriuretics. Imagine. So released from ventricles in response to overload, that is B-type. There are two, B-type natriuretics and N-type natriuretics. So when they are released in response to stretch, yes, you do that test. Now, if you are coming in right now, just know we have already assessed the patient at the emergency area. We have resuscitated. The patient is in the ward. Now, Dr. Benjamin, in a white coat with a stethoscope, has written some tests for the laboratory to go and do so that it can guide me to treat this heart. It can guide me. And whatever I've written, if you are coming in right now, I've written for this patient, go and see troponin I and T. Troponin I and T, what they do what? They are produced when your heart is failing. It is having a necrosis because you are not, the coronary arteries have been blocked. You are not getting oxygen in your heart, and what is happening? It is dying off. Please hit the like button, my friend. Hit that like button, because Dr. Benjamin is trying to help this heart to recover, man. The heart is life. Imagine if it does pump, it doesn't pump oxygen. You will die. Your body needs oxygen. So when you hear a girlfriend telling a boyfriend, you want to play with my heart, hey, just know he's telling this boyfriend, don't kill me, please. I'm emotionally completely down. You see, my guys? Yes, let's love each other and feel good when we are loving each other politely. Now, we have done troponin, we have gone to creatinine kinase, we have gone to myoglobin. Now we are at lactate dehydrogenase is an enzyme, but I've said it's not only produced in the heart, it is also produced in the body to any muscle. So this is just a relative comparison of what might be happening. Maybe you are hit somewhere and it comes out. So you cannot do a diagnosis on lactate dehydrogenase alone. So natriuretics, we have said they have B type and N type. So the B type, the B type indicates stretch in the right muscle of the heart, elevated in heart failure, cardiomyopathy, valvular heart disease, elevated in, because when this one is stretched, it means one valve here, mostly the pulmonary valve, is being attacked, or this side, the aortic is being attacked, cardiomyopathy. You saw cardiomyopathy. I've just talked about cardiomyopathy today. It was a short session. And you remember, in cardiomyopathy, we have restrictive and dilated cardiomyopathy. And this one is when the heart muscles are thick enough. Genetically, some people are born with thick muscles. And then we have another one, whereby someone is born with a heart muscle that heart muscle is not a muscle, it is a fatty tissue. And you know a fatty tissue cannot pump blood. Go check that video, find out which one has a fatty tissue that is here. You see. Now, valvular heart diseases, these ones are because when this heart is stretching, the valves are suffering. You get? The valves are really suffering. Now we go to N-type pro-nutritic peptide. Nutritic, mostly stable than BNB, used for diagnosis, prognosis, and monitoring of treatment. When you are now, we have decided you know your problem in the hospital, we just start checking on this because it is stability. It helps in stabilizing your heart. You get it? So when we find that it is 100 per gram, PG per milligram, we know, oh, this one heart failure has stricken. We need resuscitation very fast. But when we find that it is 100 to 400 gram PG per milligram, we know intermediate. We can gamble up and continue giving fluids and continue helping the heart with antibiotics and go and on. You get it? But 400 PNG per mil, that heart has failed. So this one helps us to find some things in your heart that we really need to know. Now, let's continue. We do some tests like the lipid profile, those ones. The specific one for the heart, I've said, are troponin, creatinine, myoglobin, and lactate dehydrogenase. Those ones, and nutritic peptide. So in the words, nutritic peptide is the key factor that we check on to monitor your heart. So I've said if it is 100, it's heart failure unlikely. You don't have an heart failure. You may have, but now we have done our part and it's not. So that is nutritic peptide N. But B type is the first we do before we start monitoring. For 100 to 400, intermediate, you are in the between, not heart failure, you see, but when it hits 400, you have a heart failure. Now, let's say this. There are some tests that we do associated with heart failure, or they may not be associated with heart failure directly, used to assess the risk of atherosclerosis and coronary arterial disease. You know, atherosclerosis, we talked about the fatty plaques that make the arteries to be thick and not perform well when it comes to relaxing and contraction and constriction. So we do things, when you hear a doctor is doing something called lipid profile. Lipid profile, this doctor does cholesterol levels. There is total cholesterol levels. Overall cardiovascular risk is there. Low density lipoprotein. I have to do a video on these cholesterol levels, but I did them on another topic, which was not, or just general. Low density lipoprotein is the bad cholesterol. Bad cholesterols that distract and give your body hell of a mass. your heart pumping slow, your veins not constricting and relaxing well. You get it? This one, low density the promotes plaque formation in your arteries. But we have another one which is high density lipoprotein, which is the good cholesterol. It tries to clear that bad cholesterol and it is protective. Your body needs it. And then we have another one called triglyceride. Triglyceride associated with metabolic syndrome. So those are the tests. And then we have other tests, the lipid. If you have a question on anything, please don't fail to drop it here so that we can discuss it. Yes, we can discuss everything and we feel good and life becomes good and gooder. Now, we have another thing that we call inflammatory markers. High sensitive C protein. Children are done this so much, even adults. When you are going to the hospital, you are weak and you don't know what to do, we call it CRP. If you have ever done something called CRP, when you are sick and your body is reacting to some issues, this is the protein that is elevated, C-reactive protein. So when it indicates vascular inflammation, it can predict the heart attack or stroke that is coming. Ben, doctor, what is good to reduce cholesterol? Yes, in terms of drugs, lifestyle, or nutrition. My sister, my great good sister, Sha Travels, tell me, in terms of social lifestyle, drugs, or which one? You want me to say all? All of the above. All of the above. Now I'll answer that question. Where do we start from? We start from lifestyle. What can give you cholesterol? Is it proteins or carbohydrates? Is it proteins or carbo? I don't drink. I don't party. I'm an angel. Thank you. Thank you. Just imagine how I'm saying thank you emotionally. I don't drink, even me. I don't like alcohol. But at times I party and take a soda with my friends. As they drink, I take a soda. Discipline, at par. So let's get to your question, my sister. I don't even drink soda. Soda in a good while, once in a while. Okay, I know you are taking care of your sugars. Now, proteins, before they are broken down, they give you amino. They give you amino. I want to start from there so that you can know what is good to reduce cholesterol. They give you amino acids. But when you take ugali is corn meal. You take rice, you take cassava legumes, they are changed directly into glucose. So when you have high glucose levels and spaghetti, they are changed directly into glucose. So the excessive glucose tells insulin, please come out. Please come out. Convert us to energy. But when it's too excess, it is converted to glycogen. Then where does the glycogen go? It goes to your liver to be stored so that when you will not be eating, it can be released slowly as glucose so that it gives you energy. So you can stay even one day without eating and you have the energy. So if you are eating so much, and the glucose is piling up and the insulin is doing enough work to go and convert, what does it mean? The liver will be tired and it wants to give away some of the glycogen. So what does it do? It starts to break the glycogen into cholesterols, and those are the cholesterols that you have around your waist, around your heart, around your foot. So what we can do is to reduce carbohydrates intake. One, that is the one thing we can do. Now we are at lifestyle. My sister Sha Travels. We want to reduce cholesterol and we want to be there so that our nutrition becomes good. What do? We reduce intake of carbohydrates. The other thing we check which foods lower cholesterol levels. Which foods can lower cholesterol levels? Oats, barley, beans, and lentils. Fruits such as apples, oranges, and pears that have some citrus. Yes, vegetables like carrots and broccolis, they have fiber. You get? This reduces cholesterol absorption in the intestines. You see? And then we go to healthy fats. You don't just take fats, everything that you take in form of fat. No, healthy fats like avocados, olive oil, and canola oil. Not the other fats that we buy in the Walmart, in the hypermarkets that are done what? Manufactured. Take olive oil. Hmm? Which will produce more high density lipoprotein, which is a good protein. Nuts such as almond and walnuts, yes, they produce good cholesterol. Remember, this is just a question I'm answering. We are still at our heart, this heart. We want to know what is the problem with our heart. So let's go on. Omega-3 fatty acid. Fish like salmon, sardines, and mackerel. Do you like sardines? Thank you for your answer, doctor. Very well, welcome. I'm still going on. I want to help you to know everything. Plant sterol and stanols found in fortified foods like whole grain. You see? And then we go to help block cholesterol absorption. As you take foods that have cholesterol, you do what? You have to block some not to come so that you can go to the long call and they come out. Foods limits. You should limit these foods that I want to tell you. Saturated fats like red meat, butter, full fatty dairy. No, that one I've said no, 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 no. Trans fats like fried foods, margarine, baked food. And you see, I said fried foods have more injury to your body because when you are above 35, you should reduce fried foods. Christine Long. Hi, Christine Long. Smile, 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 girl. Smile as you come to the channel. Say hello to my friends and give a high five plus a thumb to my channel if you like. Or you want me to sing for you? Smile for me, Christine. Smile for our viewers again. Christine, welcome to the channel. Welcome. Betty C, I can see you. Betty, I thank you so much for coming in the channel and listening on how to have a healthy heart. Now I'm answering Christine Long how to live well without cholesterol. So I've told her, Christine, avoid processed meats like sausages and bacons. Avoid. Hello, Dr. B and all. Nowadays, I have another name, Dr. B. Good. Now, foods to avoid. I've said saturated fats like red meat, butter, full fat, and dairy. Those are not good meat. No. Trans fats like fried foods, margarine, baked food goods. No. Baked goods, no. And I said fried foods can give you even cancer if you have a cancer marker in your bloodline and you are always taking fries. Now, processed meats like sausage and bacon. No, you can take a bit, but not always. Excess sugars and refined carbohydrates. You see, it's coming. Excess sugars and refined carbohydrates. No, bad. That is a no. That is a no. Reduce your sugar intake. If you are not exercising every time, reduce your sugar intake. Now, physically, what can you do? Physically improve when you are exercising. Calories are being broken down. Activities improve lipid profile and overall cardiovascular health. Very important, my people. Exercise. Walking. Is Barry still on? Are you still here, Barry? Walking exercise? Please tell them. Recommend at least 150 minutes of moderate exercise per week. That one is too low. We do more than 500. 150 minutes, you can walk a day and you feel nice. Effective activities like brisk walking, jogging, swimming. Swimming helps your nerves. Who knows how to swim here? Yes, Christine, that is nice. That's why you smile every day. Who knows how to swim? We know, all of us, we know how to swim. If you don't know how to swim, please tell us. I tell you something. Cycling, aerobics. Aerobics, I do them. Yeah, even in the house. You see me at times, if you go to my shorts, you will see me dancing to songs. That is aerobics. Yeah? You see, dude, you don't know how to swim. Or you know how to swim. Swimming aligns your nerves. It is called hydrotherapy. If people have back problems and the spinal cord injury, they are done hydrotherapy so that the spinal cord can align and the nerves can come out so well. Okay, nice, nice, nice. I usually know you know these things, Beauty. I know. Benefits of exercise. Listen carefully. Raises high density lipoprotein, which is the good cholesterol itself. Lowers low density lipoprotein and triglycerides. Which one? We don't want them. That one I usually say we don't want LDL, low density lipoprotein and triglycerides. We don't want. Help maintaining a healthy weight. Exercise. Just check on a person who is going to the gym always. But remember, one thing that we usually say, stop smoking, moderate alcohol. We don't want them. Natural remedies like green tea, garlic, psyllium husk, fenugreek seeds, and turmeric, soy products are very important. So if you have noticed that you have cholesterol that is rising every time, there are drugs like statins. Statins are like rovastatin and atorvastatin. You can buy over the counter and then they help you. Cholesterol absorption inhibitors like ezetimibe, and there is the one that is over the counter that is called Oristat. When you want to cut down your cholesterol, you can use Oristat or ezetimibe. In Kenya, you can buy Oristat over the counter. I don't know other countries. Please find out. For those who are struggling with big belly and then cholesterols that are rise, you can use Oristat. Yeah, Oristat. Check it. Fibrates like phenobibrate, bile acid sequestration like cholestyramine. Those are drugs that can help you to cut down the cholesterols that you have, and even they stop the cholesterol absorption in your body. They stop the cholesterol absorption in your body. There are some drugs that target cholesterol levels. Those ones we will talk about them when we talk about fully about cholesterols. Now, I think Sha Travels, you are a happy girl. Now you know what you can do to lower your cholesterol, and if the cholesterols are bringing problems, now you know the drugs you can take. But remember, I'm bringing a topic on cholesterol levels and reduction. Now, let's go to the topic of the day. The topic of the day was our heart is sick. We have taken the blood to the laboratory and the blood is being assessed. So what have we done? We have done some lipid profile. We have done some inflammatory markers like C-reactive protein, erythrocyte sedimentation rate, elevated inflammatory markers. Yes, Mercy, my sister, Mercy Grace. Mercy Grace. I have to put a pause and find you when you are online. At least I see you. You usually pass where my hospital is and we have never met. But one day we will meet. We will meet. I know you and Barry exercise. You are always doing the exercise of walking. Yes, very important. It's very important. Eh? Yes, I know it's very important. Now, we continue on something called erythrocyte sedimentation rate. When elevated in inflammatory cardiac conditions such as rheumatic fever and infective endocarditis. So when you take erythrocytes, let me talk now slowly by slowly. If you are not understanding something, help me to. I have taken. Can I have I don't have any fluid here. Let me see. Let me see. Oh, I have a fluid here. Nice to see you, beauty. Let me use this fluid here. Let me use this fluid. This fluid is called spirit. Let me use this fluid here. Yes, and then I will add some. I will add some. What's this now? I will add some ink in this. I'll add some ink because I want to explain to you what electrolyte sedimentation rate is. You know, these days you go to hospitals and sometimes you just do, and you don't know the meaning. It's not good. It's good to know. Challenge the doctor sometime, so that the doctor can know that I'm dealing with a person who is an elite, a person who doesn't sleep in class, a person who never slept in class. So let's train each other to know these things, right, my friends? I want to show you something. I want to show you something amazing. Something amazing, amazing, amazing. I want to show you something amazing. Uh-oh. Uh-oh. Come on. Go in. Ah, it has gone in. Look, I've formed blood. Now, this is our blood. We have taken it to the laboratory. So, erythrocytes are red blood cells. Erythrocytes are red blood cells. If erythrocytes are red blood cells and our heart is sick, and this is the blood. So, when you take to the laboratory, it is like this. You see, it is colored. But after some time, you will see it separating because now the red cells of this will start going down, leaving plasma above, leaving plasma above. So sedimentation is when the red blood cells are coming to sediment down. You get it? They're coming to sediment down here. That is what we call a test called erythrocyte sedimentation rate. Erythrocyte sedimentation rate. Elevated in cardiac conditions such as rheumatic fever and endocarditis because they are dying off. So it will take a short time or it will take some time before they come down. You get it? So that one is what we call, if you see a doctor writing something and say, go and do erythrocyte sedimentation rate, that is the eat and subscribe button. Thank you, thank you. Thank you, Shah Travels. Today, I cut short the live that I usually have at 4:30 because I had very bad hiccups because of some drug called ceftriaxone. It really gave me a bad hiccup. You get it? But now I'm good. Now I'm good. We can talk. You see, I'm talking like an AK-47. Now, we have something called coagulation profile. Coagulation profile is clotting factors, how your blood can clot. So used to assess clotting factors, prothrombin time and international normalization rate You see, those are the things that we use to monitor warfarin because when okay. When a person has heart conditions, maybe a clot might be there. So we need to see, is that clot active? Is that clot active or is that clot bad? As in it can kill someone. So we do something called prothrombin time. Those are enzymes and clotting factors. Activate partial, the partial prothrombin, we do them, and then we do the dimers. But remember one thing, you don't do these hard things, but you forget the normal. You need to do something called blood glucose test. Glucose test. So the blood glucose test, it helps you to check the heart. Is the heart not getting enough nutrients or oxygen, or is it the heart? Because the other thing is this, it may be two-way. The heart muscles, by being taken blood to the coronary artery to the heart to get some energy, may not be getting oxygen and glucose for the heart mitochondria to work on. The other thing is also the heart itself, the red blood cells that carry the oxygen, may be carrying a lot of glucose and it is not delivering oxygen to the heart muscle. You see, and that's where we do fasting blood glucose. Do you have low blood glucose or high? Or random blood glucose of the day? And we do something called HbA1c. If you have ever heard of something called HbA1c, it's called glaciated red blood cells. Red blood cells that you are diabetic and they are carrying a lot of sugars instead of oxygen. They are pimped up what can I say? My daughter tells me something called buttons or what? The bread that is covered with ice cream, that one. Now your red blood cells looks like that bread. Where will the oxygen bind? Where? So we need to regulate our glucose levels if you are diabetic. We need, because you may kill your heart and you are diabetic. And that's why you find that so many people who are diabetic, they have problems of heart conditions because they have glaciated hemoglobin 1c. You see, now I'm giving you good hints. Clap for Dr. Benjamin. Say hi. You see, now you answer yourself about why do people who are diabetic, they are always sometimes having high blood pressure, because uncontrolled sugar levels can give you glaciated hemoglobin and your heart will not get enough oxygen because it's pimped up with the glucose, so it has no place to carry enough oxygen. When the coronary artery are bringing to the heart the oxygen, it doesn't, so the heart compensates. It does what? It beats faster and the pressure goes up, and endothelins in your veins, they constrict. Then in your kidneys, it releases something called renin. If you have not seen that video of renin angiotensin about kidney injury, please go and check it out. It releases renin, and then you are diabetic, and now you start suffering from hypertension. So my people, when you find someone is diabetic, always check if the glucose are regulated. Complete blood count, that is a general test. Thank you, doctor, for sharing this information with us. Welcome, my sister from South Africa. I appreciate that message with all of my hands, even with a hug. Thank you so much. Complete blood count, full hemogram, we call it full hemogram, where it tells us about hemoglobin and the put it up, and the cells that are called white blood cells. We saw there are several white blood cells in your, and we have that topic of the white blood cells there. Platelets, clotting factors, and then we go and check the kidney. I've talked about the kidney. You check sodium, potassium, calcium, magnesium, and urea and creatinine, because when we are going to learn about our man and this thing here, the ECG, you are going to find out that when potassium is elevated, you can have a problem when it comes to the heart. You know, we are at the point of diagnosis. We are diagnosing a person that to get the specific thing that is destroying our heart. So we should not gamble. We have taken our blood to the laboratory. All those tests, the first test that we have done, troponin, all those, creatinine, you see, neutrenin, all those. And then now we have come to the electrolyte and renal function, electrolyte and the kidney function. When you hear me saying renal, just know it's the kidney function. So liver function test, very important. Detect hepatic condition due to right heart failure, important before prescribing statins. You see, if you have done cholesterol levels, you have done your cholesterol levels, you know you have high cholesterol, you should just not go to the pharmacy and buy statins. No, you can injure your liver and it dies completely because statins are metabolized in the liver highly. So when we find that there is liver problem and it is giving us right heart side failure, you should not take statins. There are other drugs that you will take. So don't buy for yourself. Seek doctor's advice. I appreciate all the information you share with us, doctor. Very important. And Shah is working in a hospital. Just imagine. He knows the importance of medical information. Thanks a lot, Shah. Thanks a lot, Beauty, Betty, Mercy, all of you that are watching me daily and supporting this. Thanks a lot. You are my darlings. You are everything because you will support someone at the brink of death. And you know, for me, I swore to protect life. Then we take our blood, we do blood culture. Blood culture will show you as strains like Streptococcus bacteria that kill our heart. Now we have done all that, my friends. We have done all that, and the laboratory technician has taken the report to the doctor. The doctor has seen, okay, troponin is elevated, okay, creatinine is elevated. The blood culture now is positive on Streptococcus pyogenes. We have seen the liver function test is not okay. The kidney is suffering. The sugar levels are a bit good, but not so good. What next to do? What next to do? Where from the laboratory, the patient is he has oxygen, he's not even started treatment. We have just come from an emergency of assessment, you have admitted. What next to do so that we can know the specific thing? Because you see, we have random things. Is something called the EKG. Yeah? You see, ECG, EKG. Have you ever seen, I don't know if I've had a patient of heart problem, they have gone to do an electrocardiogram and then we see some lines that come. Or has anyone ever had that thing? The lines are coming cross, and then the doctor looks at it and he says, now this patient has myocardial infarction. We're going to learn about that now. We're going to learn about that. We're going to learn about how a doctor knows. There are some, there are some things that we do that are very important with that EKG, because now the EKG shows us how these valves are, how those valves are. And it is a box with some electrodes Now that one I have to explain why I'm looking to this picture. It is a box with some electrodes that we place on your heart. And these boxes with the with the box, and it's a machine that produces electricity, and it checks on the electrical flow of this heart that we have here. This heart that we have here. So we're gonna learn about cute Jessie, my last born. How is you, Jessie? How is you, cute Jessie? Welcome. Hit the like button. And cute Jessie, I want to add you on the group. Or if you are not in the group, please text me anywhere in my videos. We connect so that I can add you. I want you to get more hours very fast. Now, there is these things that we call probes. Probes are like, where is that stethoscope of mine? This one. Probes are like things like this that are placed on your heart. There are several on your heart. And then there are another one like this that is placed on your shoulder, another one in the shoulder, and in the work of this is to detect the electric function of your heart. Because I'll explain in this way. Let's see if hope everyone is seeing this. If this cyanoatrial node is producing electricity and it reaches somewhere, it is blocked. If this is the probes that we have put on the person's heart, one of them will notice that electricity is not passing, and then what will it do? It will give a deflected line. You see, it is called the electrocardiogram. What is an electrocardiogram? You see, we should know, because this is a topic that I'm going to go very slow. What is an electrocardiogram? I want people to understand when they are going to hospital. Some things the doctors, let me tell you, you can get to a hospital and you meet a half-baked doctor. Instead of doing good, this doctor does harm to your person. So if you have information, you will stop it before harm starts. You get? And that's why I'm coming live to educate. Even I'm using the real language that is not medical and explaining deeply, so that even a student who is in school can do what? Can learn. So an electrocardiogram is a simple, painless, and non-invasive test that records electric activities of the heart over time. It's one of the important tools used in functions and diagnosis of cardiovascular system. Very important. It measures electrical impulses. ECG stands for electrocardiogram, and there is another one which is called the EKG. Comes from spelling electrocardiogram in Germany. Both the same name. So let me introduce the electrocardiogram, and then from tomorrow we'll pile up our tent to know how the electrocardiogram works. I have explained what they do. So you check this out. Check this out very slowly. You have gone to a hospital, you have done all the tests that I've said, those tests that we have said, and now the doctor wants to see where is the defect in this, where is the problem in this heart. Let me see it this way. Hi everyone. Hi Maggie, my sister. Thanks for tuning in. We have taken our blood in the laboratory, and my sister is here, Maggie. Maggie, hi. Please smile for me. I feel that you are okay. Even if you had exams. Exams are frustrating every time. Before you go and do the exam, you are always having stress. How will I perform? I'm having another one next May next month. But I know I'll perform. Me, I'm never afraid with exams. Welcome, Margaret. Welcome, Margaret. Hit the like button and share this message. Now, you take those probes. One is placed, if it is placed, let's say here, like this is the probe placed here, it will detect the right atrium, and it will be detecting the electric impulse that is produced here. So in the electric sheet, it will be drawing some lines like this. It will be drawing some lines. I know some of you have seen these things happening. I know some of you have seen this thing happening, and you've taken someone, and that someone has been done this test. So we place one probe. Let me check this out. There, there is, these probes are called the leads. These are called the leads. I wish I had that machine here. I would have shown you well with the dummy. These probes are called, there are 12 types of leads. You see, 1, 2, 3, 4, 5, 6, 7, 8, 9, and then there are others, augmented leads, which are AVR, right, left, and you see. Now, if you take this, you place here, the other one you place this, and the other one you place here. It will read this heart of yours that is here. It will be reading electric impulse as your heart is beating. So these ones are placed on your, they are called bipolar leads, 1, 2, and 3. Leads that are bipolar. I want to, today I'm just introducing, tomorrow I'll please, anyone with any question, as I am taking you how to place the leads and then I finish. If you have not liked, please don't forget to like. It gives impressions. It gives impression. So these leads are placed like, the first leads are called bipolar leads. Here we have lead 1, we have one, Dr. Ben. Yes. We have, let me check on something. We have lead 1 here. We have our lead 2. If you check lead 1, let me use a highlighter here. We have, medicine is not so complicated. It's just something that you learn. Now you see here we have our lead 1, and here we have our lead 2, and here we have our lead 3. And these leads are, they always read from the negative. So this one is negative. This one that is placed here is negative. This one is positive. We check, and then we have a positive down here. So these leads, they check the heart like this. This heart is here. I don't know if I have a mark at this one. This lead, your heart lies here. Your heart lies here like this. You see how your heart is? This is your heart, with the coronary veins going out. So that is your heart, and it is lying on, let me check. So Dr. Ben, what is your take on me walking to Kenya with my heart edition? Walking to Kenya with your heart edition is a good thing, because you'll be around a phone call away from the doctor himself. And I'll be giving you tips one by one. So don't worry yourself, Chat Travels. Please, anyone who has not liked, please like the video as we go. I'm explaining how an electrocardiogram helps us to deal with heart, to know the problem of heart issues. So don't fear coming to Kenya because of heart condition. Come, we'll take care of it if there is a problem. So don't worry, and you will not have problems when you are around people like me. Don't worry yourself. Don't worry yourself, my big sister. You are protected. Now, I was explaining your heart is here, lies here. And we have lead 1, we have lead 1, 2, and 3. You get it? So, there is something called augmentation that we do. Augmentation is checking the heart itself. This one is reading the heart from this side. This one is reading the heart from this side, and this one is reading the heart from the inferior down. So we have something called augmented leads again. Augmented leads. These augmented leads, they are placed again here, from here, here, and here. Yeah. So when we say this is the right side, this is the left, and this is the inferior. You get augmented. We call it augmented lead right, and then here we call augmented lead left, augmented lead left, and then the down there we have down, which is inferior lead. So they are placed like that, and then the others that are remaining, 1, 2, 3, 4, 1, 2, 3, 4, 5, 6. 6 leads. They are placed from the sternum at the which costal region, 1, 2, 3, 4, 5, 6. 6 costal region. The second one is placed between the sternum at the 1, 2, 3, 4, 5, 6, 7. And then down near the apex, there are 6. 1, 2, 3, 4, 5, 6. Down there, up to 6. I'll show you tomorrow how to place them. I'll have another paper like this that I will show you. So the work of those leads, is to check how the heart is beating. And I've said they check how the heart is beating, and when they come across a damaged vessel like fibrosis, they come across a damaged vessel like the fibrous layer somewhere. Sorry. When they come across a damaged fibrous layer, you see, if something is damaged and it is fibrous somewhere here, let's say here, it is having a problem here, electric impulse will not pass. So we will see as we continue how the electric impulse is deflected, and then there is a line that is not going well. And that's why this electrocardiogram is the one which produces this PQRST wave. It is the one which produces PQRST wave. We will check about it tomorrow, how it was just an introduction on EKG. Now, I have a question. I think it's question time. Anyone has a question? EKG, I've introduced it. These are leads that we place on the person's chest, and they give us how the heart, because the heart has electric impulse. You remember when we were talking about this heart, it has electric impulse. And when you place the leads, they detect the electric impulse and they draw the lines. They draw the lines as they go. So today evening, our person has come from the laboratory. The blood we took, results are there. But with this now, we want to know specific place that your heart is failing, and we want to know the correct issue that your heart is having. You see? Nice, 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 nice. Now, this is heart. This is now our topic of today. Will end there because I cannot continue with this. Too much information is not good because we will sleep in class. But now, give me the information. Who has a question? Who has a question, my friend? Who has a question? Share Travel have asked me, so Dr. Ben, what is your take about me traveling to Kenya with my heart condition? Don't worry, my friend. Come to Kenya, enjoy yourself. Heart conditions sometimes are not provoked with altitude. No, you are under observation and everything is okay. So you just come, we will see how things go on. And we thank God that we are alive and we need you alive and we need you to be like that up to the day we leave Kenya back home. Hmm? Now it's time I can ask anyone who has a question, any question from the house, any question from the house, anyone who has a question, please. Before we in Kenya right now it's 11:36 p.m. That is at night. Where you are, what is the time? Hmm? Anyone who has a question, my friends, I'm giving you to ask any question. Anyone who has a question? Hmm. Anyone who has a question, I've answered about the lipid profile. I've answered about specific. There is a question that I've asked. I was asked and I answered. And I'm still telling people there is that video that I've done on the video I have done on not getting children or not conceiving because you've been using family planning. Please, I'm begging mothers and women who are young, like my sister Cute Jessie, please go and check that video out. It is an important video and it can help someone, and share it to other people. It is very important. I did it yesterday at 10. It was an impromptu. Please check on that. Mm? Please check on that video. It can help our children or even our mothers. Conditions like endometriosis, conditions like polycystic ovarian syndromes, this family planning we are taking, they can lead us to a place where we cannot come out. So, my friends, check that video out. Share it to our young children, our young sisters that are in universities. If you have a niece who is a young lady, is in university, and you are looking at this young lady and you are seeing like hormones are coming so fast, and the boyfriend is coming here saying, Aunt, how are you doing? I'm the boyfriend. Share that video to them. Hmm? We want our children to bear as healthy children. We want our children to be fertile so that when they come to visit us, when we are old, we smile to see a good family and healthy family. Hmm? See that? That video is very important. It is very important. So anyone with a question, anyone who feels he has a question, anyone who feels I don't want to leave someone without asking any question, and you'll ask me tomorrow, and I will be taking on EKG, on ECG. Hmm? Anyone with a good question or something you would like me to talk next? Because tomorrow we are dealing with ECG, EKG, not ECG. We are dealing with ECG. But if you have a question, we can do what you like the one that I did of infertility secondary to family planning hormonal methods, and we said it is not infertility, it's delayed fertility. It was a request. So if you feel you have a request and you think you want me to talk about it, please don't be shy. Just come in and let's talk and let us help each other. Let us talk and help each other. So my question is, how do you think about my talks? If no one has a question now, answer me. What do you think about my talks? Are they long? Are they short? Should I moderate? Should I do videos? Or what should I add? Because I really need people to understand what I'm saying. I really, I've noticed outside here, people die because of lack of information. And medical issues are very important in the life of a person. Medical issues. So tell me, give me direction as my subscriber, as my follower. What do you think I can add? What do you think I'm lacking? How do I put it? How do I drive message home? Hmm? Because this message that I'm driving right now is not only helping you, it will help someone else in future at big time. You see? So leave your link, tell me how to do it. I love you all. At least we have taken our blood to the laboratory. We have done what is happening. So we want to know where the heart is hurting. And tomorrow at the same time at 4 p.m., we are going to deal with this EKG, the electrical machine and those probes that will tell us this is where the heart has a problem, and we will get to know how to handle the problem. So I think today people just want to listen. I've taken over 1 hour. It is going to 1 hour 40 minutes. Be blessed where you are. No question today. Please be blessed where you are. I thank you all for tuning in and staying with me. I am Mama 4. Your talking is okay. Very informative. I am Mama 4. Hey, this is your first time in this channel. Welcome, welcome, Mama 4. We have prominent people and love you, Doctor. Thank you, more Doctor. Thank you so much. Thank you so much, Beauty. Mama 4, please subscribe and like. Eh? Subscribe and like the channel. Although you have come late, I usually come online at 16:30 Kenyan time. But if you see I've come right now, just know it was a request. Just know it was a request and I had to do it. So tomorrow 16:30, where you are, check the time. It will be in Kenya. I'm in Kenya. Check the time that will be where you are. I'll be online at 16:30 tomorrow. So thank you for subscription. And when people join and they say you are doing a good thing, you know what I feel? I feel to pray for that person that God can give him more life so that this person can be okay and her and his generation. So let's meet tomorrow at 4:30 Kenyan time, and let's know how this EKG works, because you can save a life. You see, the more we are talking, the more you realize even you can save a life. It's not just the matter of a doctor, even you can save a life. Thank you so much for tuning in. I am Dr. Ben. If you have any message or any topic you want us to talk about, just send me on my email address. It is benjaokwesh@yahoo.com, and I'll talk about it when you want. Let me write it down here. benjaokwesh@yahoo.com. So guys, that is my email address. If you feel you have a topic you want us to talk about, you can send me there an email address, or you can text in a chat and then I'll preserve it. So have a lovely time wherever you are. Let's meet tomorrow at 16:30. Bye. Bye bye. May you be blessed, everyone. Bye.